I wanted to change my DP here.
We are live.
Good afternoon and welcome. Welcome to the COVID313 Coalition for Families and Students. My name is Jametta Lilly, and I am so blessed to serve as the CEO of the Detroit Parent Network. But also I am a proud member of this coalition that for now 2 years has been bringing our community trusted information around education, health, basic needs, and social justice. And if you're just joining us, we want you to go ahead and get a little comfortable because when we have these conversations, we're always hoping that they will be two-way. So as you're getting comfortable with the program that we're going to have today, would you in the chat, whether you are in the Zoom with us now or if you're on Facebook, tell us where you're joining us from. What part of the county, what organization, and if you're a parent, what are the ages of your children? So chat us back. We want to hear from you. We would love also to know, how did you hear about us? We're really so delighted because part of our partnership has been not only the 25 organizations that have been coming together to make this possible, but also Detroit Public TV is also our major backbone for communications. So did you hear about us that way? Did you see about us on Instagram? We would love to know how you are making the connection to us. And we also always want to know what are the topics that are important about health, education, basic needs, and social justice that are important to you. Please take a few minutes and tell us what's on your mind. We really want to hear from you. So our program that we do is really a collaboration. It's really an act of love for our community because we know how important and how devastating, difficult, challenging these past 2 years have been because we've been experiencing it with you. And so we have to do this as a team. And so part of the team that brings this program to you also, we're so happy to be able to have interpreters in this work. And so we always want to make sure that we not only have language, but also ASL is available to us. And I'm going to ask if we could have our ASL come on and say a greeting from the COVID313 Community Coalition for Students and Families.
Hi, my name's Becca. Nice to be here. Thank you.
Thank you, Becca. Welcome. And also, we are going to have Spanish interpreting.
Buenas tardes, Cristina Guzmán. Yo les voy a hacer su traducción en español y si quieren recibir traducción, por favor, vayan al archivo adjunto en el chat o nos pueden seguir en el Facebook de Urban Neighborhood Initiatives. Gracias.
Gracias, Christina. So families, this is how we do what we do. Sharing information, making sure that you have access, whether you're through ASL, also through different languages, and also know that we want to hear from you again. Facebook, Zoom, hit us. But I'm also in this space with some other very special people. So right now, as I get to serve as the co-moderator with another very awesome woman that has been part of the production of this phenomenal experience for what, Christine, 2 years?
2 years next, really next town hall. Yep, 2 years.
So here we are. So it's been a blessing to be in this space with you, to see your smile, and to know that we are loving on and informing our community. With that, I'm going to pass the baton to you.
Thanks so much, Jametta. And it has been quite an honor to stand beside you in the last 2 years. You're a phenomenal woman. And I think we keep saying women so much because we just want everyone to remember that it's the month of the woman.
Right, International Women's Month. Right.
Yeah, I'm clearly not as good at the month, but
right. It's Women's Month and National Reading Month. We almost forgot that.
Yeah, and National Reading Month.
Okay.
So go ahead and read about radical, phenomenal women. And I would describe Jametta as one of those women.
Oh, wait a minute. I got to come back up. Wait a minute, hold on. Ditto, ditto, ditto. You can tell everyone this is kind of love fest because through COVID, we've learned how to encourage each other, lift each other up, whether it's men, women, whether it's parents, whether you're executive director, we all need love and support and encouragement to do this work. You've got it. I'm off. Okay.
Awesome. Okay. So we also have some really phenomenal women experts that are here with us today. We want to remind them to please speak slowly for our translators. Our translators want to make sure that they're translating the important information that you're sharing correctly. Also, remember to turn off your camera when you're not speaking to ensure that our ASL interpreter can be seen, and mute yourself when you're not speaking. Terry Whitfield, the best timekeeper that I know, will let you know if what your time is and if you're getting close to the time when you need to wrap up. So keep your eye on the chat. That's how he'll be communicating with you. And then if you're starting to go over your time, myself, Jametta, or Rajeshri, our other co-moderator, will come onto the screen and gently remind you to wrap up. While we're, in a love fest about women, we also know that we are in incredibly challenging times and have been for 2 years, and some of the challenges keep arising. So we want parents to know that we are living through difficult times, and we want to let you know that we hear you, we see you, and we relate to you. And quite frankly, I am you. I am a parent. That is why we've gathered useful resources that you can use to talk to your children about the current event. The war in Ukraine and the pandemic. And also in our upcoming town halls, we'll invite experts to join us to give us more information on how to talk to our children during these really difficult times. Right now, we're going to drop some links in the chat. And these resources are from PBS, Sesame Street, Detroit Public Television, and the Michigan Learning Channel. And they are hopefully going to be helpful guidance in having these challenging conversations with your children. And to be really transparent, I actually asked for this because I am really struggling to think about how I talk with my kids about particularly the war in Ukraine. It's a really difficult thing to describe and know, what exactly to say. So those are going to be dropped into the chat momentarily if they haven't been already. And there's more to come in the upcoming town halls. And with that, let's get our program started. We have with us Dr. Barry Hall from Grand Valley State University that is going to share some information with us about college access. We're at that time, sending in college applications and making decisions about what our next steps look like. So Dr. Hall, take it away.
Thank you so much for the warm welcome. I'm so happy to be here and be with everyone to talk about one thing I love tremendously, which is college access. So greetings, everyone. Again, my name is Dr. Barry Hall. I work at Grand Valley State University as an assistant director for the Charter through College programs and also the interim director for the Office of Multicultural Affairs. I only have a short time, so I just really want to jump in and really share what universities are doing to ensure that your child, if they're a senior right now, looking to apply for colleges and start colleges in the fall, and those who are coming behind are having a safe experience, because we all know how impactful this pandemic has been to our children. Students being in a remote learning, we have seen decline in academic grades, we have seen decline in engagement levels. And, higher ed is one of those resources that we too had to figure out how to get this done and how to do it correctly for our students. And Grand Valley State, Michigan State, University of Michigan, Ferris State, We all have had time to put together COVID protocols to ensure that when you send your child off to college this fall or next fall or whenever your child's going to be graduating, that they're not only safe, but they have a sense of belonging and they can do what they want to do while they're there, which is get a degree, grow up, become a responsible adult, and make an impact on lives and the lives that they have, the pleasure of being able to interact with on a daily basis. One thing universities are doing for the admissions process, a lot of universities are waiving the test option. So what that means, the standardized test in Michigan is the SAT testing score that is used on an annual basis as part of an admission requirement for universities, some community colleges, and others across the country. Mostly all the universities in Michigan have waived the testing option due to what the pandemic has really caused, right? With a lot of students not being able to take tests due to being in a virtual environment, not being able to prepare, have the resources. We're just trying to eliminate those barriers that are put in place to ensure that anybody who wants to go to college has the opportunity to do so. Another thing that universities are doing to ensure that we're feeling safe is that they're putting together COVID protocols based off their communities. I can't speak on all universities with a short period of time, but I can share at GVSU, our President Mantella, and our leadership team, our COVID response team, have meetings regularly, at least 2-3 times a week to ensure that the university is putting our GVSU community first to ensure that faculty, staff, and students can be safe when they're on campus learning or doing what college students do, enjoying a basketball game, going to a party, hanging out, all the things that come with college. And we have a very detailed COVID plan that is open to the community. All universities, if you're currently looking for possible locations for your child to go to, on everybody's main page, there's a COVID response plan. Please click that and see what the universities are doing. Be sure that you can feel comfortable and feel safe to send your child to college this coming fall and moving forward as well. Another thing that universities are doing is trying to eliminate a lot of the financial barriers that are being put in place. Again, with the short period of time, I can't share all the wonderful things that many colleges are doing here in Michigan, but with GVSU, we've launched a lot of different financial aid packages to help students live their dream of being able to go to college if they choose to do so. One of those things, Dr. VP Trust created a great plan called the GV Pledge, which is open statewide. Any student whose earned income is less than $50,000 are able to go to GVSU tuition free. I'm going to say that again. They're able to go to GVSU tuition free. There are other scholarships and other programs that we're putting in place to relieve some of that stress, some of that anxiety of, I have to pay for this to make this happen and get things done as well. So between financial aid, barriers being eliminated, the testing option and allowing access being eliminated, and putting together COVID plans to ensure that everybody within each college communities is being protected and their needs are being met. Universities are doing a number of different things to ensure that we can run like we're supposed to run and have the success that we're supposed to have. One quick note I want to add before I turn it back over is that there are a lot of important deadlines, right? March is a very important time for college applications. If your child or students that you work with or that you're in connection with have not applied to a university, this is the appropriate time to make sure that you're doing that. Financial aid, scholarships, admissions deadline, housing deadlines all occur in the month of March. Some universities are extending that due to the COVID. So please check the universities that you're interested in to see when those deadlines are. But I don't want your child to miss out on any of that financial scholarship they could be receiving to go to school and any other awards that may be available to them. I am easily accessible. I'll make sure to share my communication with the team here on how to reach out to me via email, phone, whatever the case may be. But I'm so happy to be here and thank you so much for having me.
Thanks so much, Dr. Hall. Good to see you. And thanks for sharing those important pieces of information for the parents and students who are watching, because we don't want to see COVID stand in the way of anyone's dreams of going to college. So appreciate your sharing with us, and we'll look forward to having you back again. All right, well, welcome everyone. It's good to be here. I'm excited to bring on a guest that's new to our town hall. If I could ask Dr. Saini to open up her camera, and there she is. I'd like to introduce Dr. Anvita Saini. She's an internal medicine physician. She has been extremely active on the COVID response front. In fact, I believe she got started on responding to COVID even before this group started responding, and I'll let her talk a little bit about that. But she's a physician, and she's been seeing patients in several health systems across the Metro Detroit area. So welcome, Dr. Saini. Thank you for joining us. Let's start off by talking a little bit about mask mandates, because obviously they are starting to, and they are being dropped. And so how do we stay safe when masks are optional? And how do we keep our children safe when masks are optional?
Absolutely. Thank you so much again, Rajshri, and the entire team for having me here. It's truly my honor, and my God, I'm truly impressed with all this amazing work all you women are doing. I again, it's my first time, and I'm just very touched, especially in the Women's Week. Having said that, yes, as you said, none of us were ready for this. Now, as we all know, we're stepping into the third year. We didn't know what was coming our way. It's an invisible enemy that we're fighting, and we have heard all these words. So the unknown still remains. The fear is getting better, just because I can probably share some recent numbers with you. As of just this morning, as we know, more than 81.4% of US population has been vaccinated. So we have this, let's just say some kind of satisfaction that there is some kind of barrier against this invisible enemy. But taking away the masks, again, it was something to do more for the thought process of the community, as well as the battle that as physicians are still facing in healthcare. COVID is gone, but it's not completely gone. This variant, as we all know, is ever changing. Even though things have plateaued, we just don't know what tomorrow holds. So the uncertainty still stands. But I totally understand the burden and the decision-making of removing masks, especially in children and across the communities, has been a big challenge for everyone. And this whole decision-making is kind of following at this point to everyone, on individual school levels, the town levels, as focused groups to make this decision, what's right or wrong. So having said that, and coming back to your question, it's definitely, I would say, yes, we are at a more comfort zone now. Unfortunately, we can say that US still holds the top spot out of some numbers that we had seen. Out of 452 million people who were tested positive, unfortunately, 79 million of them are within the United States. The numbers are decreasing remarkably, but we still, I would say that we have to use precaution. Even though masks are being lifted, we have to use our own judgment at this time. We know more about how to treat the symptoms, but believe it or not, most of the COVID cases in the hospitals and nursing home settings are still being treated the same when we had initially started.
That's amazing. So even though we're 3 years later and we know more, we're still sort of, to some respect, we're still treating patients in the way that we were when we started. Yeah. Dr. Saini, one of the things that I found interesting when you and I spoke ahead of time, and you just mentioned it today, is we haven't talked a lot about how those in nursing homes are being cared for. I mean, we've talked about the fact that many of us who have loved ones in nursing homes were limited, have had limited access, but how are patients, because I know that many of our listeners and watchers may have loved ones in nursing homes. How are they cared for? How are they staying safe?
Yes, it's a very good question, Rajshri, because just my recent work has allowed me to be part of the hospital systems, office, and nursing homes. And the biggest thing I tell everyone, the hardest thing is to see these loved ones suffer and even die alone during COVID. So even though the state has restricted and lifted a lot of barriers and visiting protocols, most of the patients who are coming to the nursing homes are still being put into the 7-day precautions. They are not able to go back to the main floors. And it's hard for the family, especially with coming from a high risk areas, to be able to meet them, for the staff to care for them, or even us physicians. It's still the challenge that stood long time ago stands. And these are the patients who are coming out of a hospital setting and going into the nursing home, hoping to get that one-on-one interaction, more for psychological or even physical well-being, for that rehab. The barrier still stands today, but there is weekly meetings. The state has been actively involved to implement protocols. They're making visits, random nursing homes throughout the state to make sure, all the barriers and the protocols are visited. And it's a collaborative approach from the nursing homes, the families, as well as the patients, to understand that deep down it's the safety for everyone involved in the community.
Okay, so nursing homes, we're still seeing high levels of precaution, and we're still seeing that elevated protocol. Okay, yes. which is reassuring. I mean, yeah. Again, for those in the nursing homes and those caring for them, that makes sense. One of the things that, as parents, biggest decision we had to make, I guess this week, for us and for other parents, it was before, was to mask or not to mask, because our school made it optional. How do you help? What advice do you give parents when they're making that decision and that consideration? And especially, what about parents of children who are immunocompromised? What should they consider?
No, that's a very good question. This is a question I battled myself. I'm a mother of two, a high schooler and a middle schooler. So again, the first thing we can do is get them vaccinated. Of course, the risk is definitely there, much higher, I would say 10-fold higher for an immunocompromised patient versus someone who's not immunocompromised. But the 3 doses of vaccine, as we know, 1-3-4 rule, first day, third week, and fourth week, or 1-4-4 rule for some of the mRNA vaccines, is the first step that we can take. Other precautions we can take is, please note that some of the big conferences are still mandating a COVID negative test, as well as use of masks, the big conferences. So even though some of the barriers are lifted, everyone in the community is still taking precautions, especially for these youth events, to make sure that's there. Even in those schools, the masks are lifted. It's actually not lifted, it's optional, at least in the North Villanova area. So parents are using those precautions for big gatherings, school events, sports. So I would say continue to do the same. If your child is sick, do the needful. Please make sure that you get them tested, give them Tylenol, Motrin, but be safe for your own kid, because that's the only way the message will get out there,
Absolutely. Dr. Saini, your camera turned off. I know, because I do that all the time myself. So, and then it did it again. We want to see you. Yeah, I think you're right. I think this idea, and this is what we had to explain, and my daughter's 6, so she's younger, but mask optional doesn't mean no masks. And we talked about the fact that the teachers in her school in particular are still wearing masks. So, and it was hard because I had some parents say, well, I'm going to let the child decide. And I said, well, they can decide to a point, but they're still young and need our input. And so we've had a few conversations, and I believe that, she has worn a mask some days and taken it off at times. But most importantly, and I think this is for all of us, is we should make sure our children feel comfortable wearing a mask if they want to wear a mask. Right. I coach basketball for kids, and I still wear a mask, even though the mandate has been lifted, because I know I have players on my team who want to wear a mask, and that support is helpful to them. And that's what I've seen, some of these kids do for each other also, is if they've got a friend who's wearing a mask, they wear a mask to give support. And more importantly, I think they're understanding that the social distancing, and, that's still something we need to do. So I think the important thing also, as you mentioned, is to make sure that the kids understand that COVID's not gone just because we're loosening things up, and then, Dr. Saini, one of the things that I noted in your bio was that, you received a presidential medal. Could you share a little bit about what work you've done and kind of what you've seen in your on the ground work in the community, and questions that you've seen people ask, but kind of what led to that?
Sure. Thank you, Rajshri. I am a part of a MAPI, Michigan Association of Physicians of Indian Origin, and I used to be part of, I used to chair some of the health fairs in the community in Ascension Systems and local temples and churches. So when the COVID hit in March of 2020, I just decided to have a phone line, a hotline through my own office to reach out to the patients who could not reach us, a huge support from the temple administration to have that implemented. And that's all it took. We reached out to people. There was flyers made that received some attention for local nonprofit organizations who wanted to expand this effort. No one knew back in 2 years ago how long this was going to last. And at that point, it was not even called a pandemic, right? So none of us have hopefully lived through one, and will obviously hope there is none no more. But just that's all it took. One opportunity led to the other. Then soon we joined some India task force teams where we created a group of physicians throughout the country who was able to reach patients across the globe, starting from pediatric patients to elderly, to homebound, to nursing home, and even hospice cases. From there, we were, of course, able to do medical webinars, education webinars. The first vaccine webinar, we were the first ones to do it in December of 2021, actually, December of 2020. And again, just from there, we started to have vaccine drives in the various communities. The first one was done in January when everyone had a waiting list and had to sign up for these, and people were fighting over these Pfizer vaccines. From there, our effort took on to the COVID crisis in India. So we decided to make a COVID crisis hub. From those Indian channels, we were able to reach definitely far beyond that we expected, and collaborated with associations across the state. We even met Governor Gretchen, who was aware of our efforts and has even, is in the process of implementing some ideas for post-COVID care for the patients. And that's leading up to something very exciting, which is a national health fair that I believe we spoke about briefly yesterday. So.
Yeah, I think what would be helpful, Dr. Saini, is I know that you all are still doing many of these webinars and information sessions. It would be great if you could share with our group the links or the websites for how people can find out about those, and especially the health fair. Absolutely, that maybe you can share a little bit of information about what the global health fair will be, what you'll be doing, and the why behind it, because then we may have some folks listening that might be very interested in participating.
Wow, that would be great to have this introduced on this platform. Will be an honor for us, actually. So yes, the virtual National Health Fair, it's being collaborated with Lab Corp, LAB Corp. These are the labs which are available throughout the state: Troy, Detroit, Canton, Novi, Northville area. And all it is, patients have to go register on this link, and for $25, again, it's a cost to the lab itself, they'll be able to get tested for 5 things: CBC, CMP, thyroid, diabetes, and cholesterol. Regardless of what background you are, if you even have insurance, don't have insurance, or even, you're somebody a visitor from, across the country, for all that matters. Any age group can go and benefit. This will be launched for 30 days. Simple 3-step process. Number 1, click on the link and register. And then you have 30 days from that registration to go give your blood sample. And then within 1 week, you will get a call from one of the physicians who, like myself, who is volunteering for this global effort. Actually, not global, national effort. So far,
not
it's
global yet.
Not yet. And again, it's the first time. It was done in North Carolina with a huge success. But like you said, right, people are coming out of COVID. There's so many cases we're seeing with heart disease. People were scared to get out there, or even just having reassurance that everything is okay could definitely have a huge impact, especially with the mental instability that we're facing. And one more thing, the mental awareness webinar is our next project. So I'll be happy to share that on your platform as well.
Absolutely. Thank you so much. So you guys heard it first here. For $20 and a blood sample, you can have yourself assessed and analyzed for the 4 to 5 things that she talked about, because I know so many of us gave up our our health, taking care of our health because we were afraid to go to the doctor. So appreciate that, Dr. Saini. Definitely will be sharing that information. We appreciate your being here today. Thank you so much and keep up the great work.
Thank you. Thank you.
Take care.
Bye-bye. Bye, everyone.
It's my pleasure now to introduce one of our regulars here from the Department of Health. So if I could get Nurse T to join us. Hello, hello. It's been a while since I've seen you, but welcome back to our town hall here. I know that you've got some information to share, so I'm going to leave it to you to do your thing. Thanks for being here.
Thank you. It's always a pleasure to be here. Thank you. If I can share my screen, and of course, us at the City of Detroit Health Department loves to share data. Some data was mentioned, but we're going to talk about springing forward in the City of Detroit because it's getting ready to be springtime. It's March. But what's our current data right now? Our current data as of March the 8th, unfortunately, we're looking at these numbers that are high, and these numbers are actually including or starting from the whole start of the pandemic. So over 120,000 confirmed cases of COVID since the start of it. And we've witnessed and had over 3,200 confirmed deaths because of COVID. If we look at the right side of the screen, the positivity rate as of recent this week, Michigan has come down to 3.8, Oakland County 4.2, Washtenaw 3.2. When we look at Detroit, we're looking at an all-time low level of 0.7. I want to keep in mind that these positivity rates are not including those that are taking home tests. They're not including those that are not taking tests at all. So we have to keep that in mind. These rates seem low, but at the same time, there's a lot of individuals that are not having to test. What are the vaccination rates in the City of Detroit? So if we look at these numbers here, completed 45.6 in the City of Detroit, Macomb County 60.6, Oakland County 72. So we have to keep that in mind also. You can find this data on detroitmich.gov. It also includes, who's getting vaccinated. The ages are there. Our children, 32.2 for 12 and up. But if you look down further, you'll see that a lot of our seniors were vaccinated. And that's important to remember. So in the City of Detroit, what are we doing right now? Because there's so much going on. A lot of us, we're finding out that a lot of people, as the doctor mentioned, are having anxiety, pandemic fatigue. We're hearing about the attack on Ukraine. Gas prices have, gone up. Food prices are gone up. So what can we do? Take one day at a time. And how can we stay in control? Staying in control. Take a second. Take a deep breath, because we can't control anything but our breath at this time. Checking your surroundings, knowing the data. How do we find out where the data is? DetroitMich.gov. You can go on there, you can find the data, find where you're going. If you're going to go to a store and that zip code, you can actually look up the zip code. Find out, should I go to this zip code? You want to find out where the danger is, if that makes sense. Utilize your tools. Still wearing a mask. As the doctor mentioned before, we're still in a pandemic. A lot of people say we're going closer to an endemic, but a lot of us still have anxiety about our children. We still have anxiety about catching COVID because it's still present. Hand hygiene and testing is still important. As we mentioned before, and if you're not sure if you have COVID, if you have a new sniffle, a new headache, or anything like that, get tested. You can get tested at our location on Rosa Parks just by calling 313-230-0505. What about masks in Detroit? Because of our vaccination rates being low, we definitely want to encourage, as our Chief Officer Denise Ferrazzo has mentioned, in the city of Detroit, think about wearing a mask when you're looking at your surroundings. Think about wearing a mask when you're looking at your data. If you're anxious, wear a mask. Have conversations with your children. Have conversations with your family members. A lot of us have not, as was mentioned before, haven't gone to the doctor because we're anxious about going to anywhere. So we haven't gotten our health checks like we used to. I personally have just recently made an appointment. I haven't been to the doctor in two years because I was busy, because I was afraid, because the appointments were, a little lax. And it took forever to get into a doctor's office. But this is the time to spring forward and taking control, making those appointments, making sure you wear those masks, making sure that you're still using social distancing. Detroit, for the city of Detroit youth, they are available to get vaccinated at the Northwest Activity Center, the Detroit Health Department. They simply, an adult 18 and over just has to call the number 313-230-0505. And with that a parent or guardian needs to be present. They do need to have ID, and they also need to sign a consent form for that youth, because the youth also needs to get vaccinated if they can. The United States is still offering Pfizer, Moderna, Johnson & Johnson. Those are available. If you have any questions related to COVID, please call our COVID hotline at 313-876-4444. You can talk to a nurse if you press option number 3. And we can talk about the third dose. We can talk about boosters. We can talk about anxiety. We can talk about pandemic fatigue. The locations in the city of Detroit, we have plenty of locations for vaccinations. We have very few listed here, but we have a lot of locations. Call 313-230-0505 to find the nearest location to you. I just quickly want to touch on this here. The CDC has kind of put a calendar together where that doesn't confuse people and gives people a visual on, when should I get my booster? When am I fully vaccinated? If a person for our regular community has had the primary doses, which is 1 or 2 doses of the Pfizer or Moderna within 21 to 28 days, that's fully vaccinated. A booster on top of that adds another level of protection. Those can be given 5 months after Pfizer or Moderna primary series. For Johnson & Johnson, the primary dose is 1 dose of that Johnson & Johnson, and the booster of an mRNA can be given at least 2 months after that vaccine. Now, there was also some, confusion about, just recently because of the new change, because the immunocompromised for 5 years and up. We do have young children that are 5 years and up that are needing to take the vaccination or take a booster. So this series here, when are you fully vaccinated? So for the immunocompromised, you're going to get 1 dose, 2 dose, and 3 dose. Then you're fully vaccinated. Okay. And then it goes into that extra layer of protection. And that's what we're focusing on right now. That extra layer of protection, that booster dose, is still given 5 months after the Pfizer or Moderna, and for the Johnson & Johnson, 2 months. So there, and again, if you do have any questions related to this, give us a call on our COVID hotline at 313-876-4444. And then I'm going to stop right here and just give our contact information. If you have any questions, you can always email us at dhdOutbreak@detroitmich.gov. Talk to a nurse 8 a.m. to 6 p.m. Call to make a vaccination appointment. Make your testing appointment at 313-230-0505 for food assistance, because we are the City of Detroit Health Department. We like to make sure that we have resources available. You can call 211. Again, questions, please feel free to call us. We are available and we want to make sure we're here for you. At this time, I am done. If you guys have any questions or anything, please feel free. And we always appreciate you guys having us here.
Tanea, Nurse Tanea, we deeply appreciate you. Not only do you always show up, but you show up and shine, and the love and commitment that you have for community that I don't know if some of our audience knows. The Detroit Health Department in particular, and Nurse Tanea and some of the other awesome nurses, because we all know how important nurses are to our healthcare system, are out there in the community. If you don't mind, Tanea, I want to give a commercial that if you are a community-based organization like the Detroit Parent Network, we call DHD all the time to partner with us in terms of sharing information with the community. And I know that Christine Bell at UNI and others have done the same thing. That department is here to work with us as we not only help to push back and hopefully stop COVID, but to work on our ongoing health and wellness. And thank you, Tanea, for talking about the challenges that we are feeling, because we are human beings. So we have experiences that are both physical as well as emotional and spiritual. Christine, do we have any questions from our listeners?
We do. So there is a question. Why are some places charging to give the COVID-19 vaccine?
That's a really good question. I've had some callers call and ask the same question. What we see is those are not from the City of Detroit Health Department. Any vaccine that we give COVID related is definitely free. We offer those with no complications or anything. The ones we're finding out that might charge are coming from pharmacies that basically want to, I guess, charge an administration fee, or however they word it, but that's not from the City of Detroit Health Department.
So Tanea, should, as folks are going to get their vaccines, if someone is charging, should that be accepted, or, should the vaccine be free regardless of where you go? Because testing is also starting. I had my kids tested recently, actually, and I got a bill for it, which is the first time we've ever gotten a bill for it.
I hate to see, we might see that more.
Okay.
But it should not be. Again, if you call us at the City of Detroit, anywhere should be free right now, as far as COVID, as far as testing, as far as vaccination, it should be free. Okay. If you have concerns, give us a call. We have plenty of testing sites. We have plenty or resources that we can give for you to get to the nearest vaccination clinic or testing site to you.
That's free.
That's
so
free.
The person that asked that question.
That's free, yes.
If you call the health department, they will tell you where the free testing and vaccination sites are. And some of those are the Detroit Health Department, and some of those are your partners, correct?
Yes.
So I'm
Yes.
thinking about Chaz and Wayne Health as their mobile clinic is going around. Those are free testing, free vaccines at those places, just as examples.
Yes.
And then, Tanea, you talked about Detroit's infection rate. Is that with the new infection, I'm sorry, not infection rate, the positivity rate.
Mhm.
The last numbers I looked at, they were still quite high in the 20%. I want to say I looked at it 2 weeks ago. So has it been consistently dropping in the last 2 weeks?
It has.
Okay.
It's actually, I was surprised when I looked at it yesterday at 0 point, what was it? 0 point. I was like, what? Yes, but we have to keep in mind those that are not getting tested. A lot of people did get home tests. So instead of reporting those positivity rates, we don't know. So we have to keep that in mind. That's why it's important to talk about, the positivity rates, but also to mention those that are not testing, those that are testing, but not reporting those tests. That's why it's important to mask, but also looking at the vaccination rates too.
Could I add another piece to that? I think too, it's so important for our families and children, remember, to get in for their regular well child visits, because when we talk about vaccinations, those are immunizations. And as our health partners would tell us, the immunization rates are going down for our children, and our children precisely need all of those vaccinations to keep them healthy. And as adults, we too must get in for our regular checkups and not to be deterred. And if you hear something that says, oh, they're not taking it, no, you need to call your clinic. Because again, we want to stay healthy, not only to combat COVID, but the health and wellness of us right now and the future depends on us connecting, getting the health care that we need, getting the health insurance, and quite frankly, making a phone call when people are trying to charge you for something that we know that the government has made free for all of us, which are vaccines as well as testing.
And I'll have to find out how we report that, because I'm not sure. We have had several phone calls about some pharmacies that we know of that charging.
Yeah, and in fact, quite frankly, because we exist as a vehicle to help support and empower our community. Let's ask families that, as you have identified, make sure that, Tanea, could you kindly give your number? You've done that before, because we need to make sure that there are not people out there taking advantage of our community, particularly that the billions of dollars that have been made available for free testing and vaccines. Is there a number, Tanea, that you could put up for people to call?
Yes, thank you, Ms. Jametta. That number is 313-876-4444, 876-4000. If you remember that one, that'll get you to the 4444 number. Detroit Health Department, give us a call. We're here. We're available to answer your questions.
And just one last question. We've been talking about physical health, but and we've heard and we know how important our emotional or our behavioral health. Does the Detroit Health Department also offer behavioral health services? Do you have to be on Medicaid, or is that free for the community? Can you just share a little bit about how we can access the behavioral health resources? We know they're available with many of our health partners, but we don't necessarily know about the public health opportunity with the city.
Thank you, Miss Lily. You are so awesome. Yes.
You gave me the script. No.
I tried to bring it out. Calling, again, that number 876-4444 will also give you access to our lovely behavioral health team.
Okay.
And we actually will come on Zoom, we'll come to your place of business or anywhere in the city of Detroit and talk and have these talks about anxiety, pandemic fatigue, just listening. Because one thing we may have lost in all of this is listening to each other. Listening and not readily giving an answer, but just listening. We all have a story.
So Tanea, can you talk a little bit about the relationship right now with the health department and the public schools, charter and DPS, and what advice you are giving them as they're making decisions about testing and mask policies and vaccinations? So could you share a little bit about that, as because I know being a parent, that's top of my mind. And actually Ferndale is still masked. So so I'm just curious what, how has the health department been involved in advising our public schools?
Great question. As far as advising our public schools, right now we are actually in the process of training the nurses. We have town halls this week coming up, and we've had one 2 weeks ago to train the nurses on how to talk to the children, listen to the parents, and have these conversations. That's number one. Then we go into the schools and we talk to the students. We debunk those myths that they're hearing, because they're still hearing those myths about microchips and is COVID real? Unfortunately, we're still hearing that, those questions. And also being available to answer those questions, and also taking our behavioral health team into the Detroit public schools and talking about anxiety, what a pandemic fatigue symptom is, or what pandemic fatigue looks like for a teenager or a young person, because not only are we dealing with this, they are. And it seems like, talking to the youth, they've kind of been set aside because we've had to deal with this, that, and something else.
and this, yeah.
And have left them, and they're sitting there like, hello. So having these conversations with the youth, we are available. Youth can call us too at that number at 313-876-4444. We want to talk to the families. If there's a family gathering, we got spring coming up, spring break. And that's unfortunately where we might see the numbers increase because of those gatherings. The kids are out of school. Parents need to go to work. I'm a parent also. I have a 10-year-old, and he wants to wear a mask. He's like, Mom, I don't know. He's vaccinated. He wanted to do that. But we've had these conversations. What do you feel about this? Do you want to wear a mask? And I tell him my concerns with his concerns. And we come together and make a decision. And he wants to wear a mask. I'm glad.
Right.
So I don't have to worry about him taking it off or anything like that.
That's wonderful, because he's got a super mom, so some of that's got to affect him too. I really would just love to share with all of you one of the things many of you've heard about Governor Whitmer's Racial Disparities Task Force that's been led by our Lieutenant Governor Garland Gilchrist, and I've had the absolute honor of being a member of that task force. Just last week, we released the latest report. And there were wonderful things that have been identified. One of the things that the task force has done is work with the Michigan Department of Health and Human Services to come up with innovation that helps us connect more of our families and individuals to mitigate COVID. Well, I'm delighted to share the Detroit Public Schools, their school-based health clinics are now going to be providing vaccines directly in their clinics. And even if there's not a school-based health clinic, which we know should be best practice for every school, at minimum that the nurses will be able to do vaccines directly. I'm real excited about this, having been a proponent for school-based health clinics for decades. And I know you are, Tanea, too, because now the health department is also helping to train some of those nurses. So Christine, and to all of the families that, particularly those of you, if you have children in DPSCD, encourage your charters to do the same. The schools are going to be providing vaccines for the children directly, as well as testing. And so make it a family affair. We can trust our school nurses. We can trust our schools to be a place where we all get well. And I think that's the perfect opportunity for me to hand it back to you, to Christine, because Dr. Vitti, I was just giving a shout out about the DPSDD new project where school-based health clinics are going to be the place to go for ongoing care, but obviously also to get their vaccines. Wonderful.
Can you hear me?
We can hear you, Dr. Vitti. We would love to hear about, and thank you, Jametta, for that was like a really amazing segue. So we'd love to hear, Dr. Vitti, about what DPSCD's current plan is around COVID, including the school-based health clinics, providing vaccines and masking and so on and so forth. So we'll let you take it away.
Sure. Good afternoon, everyone. Thank you for having me as always. In my car, just got done talking to our principals here at Randolph. So that's why I'm in the car doing it by my phone. But, you know, one of the few positive things that happened from the pandemic is the opportunity to engage virtually no matter where you are. With that said, we're just excited that kids are back in school, and it looks like we have a runway where now they'll be in school for good, hopefully, unless there's something that happens with this pandemic that we're not expecting. But we are one of the few districts that continue to mask. We're doing that because in partnership with the Detroit Health Department, they're still concerned with low vaccination rates. But there is a likely path to us not wearing masks after spring break, where we want to make sure that we don't see another surge like we did last year around the spring break time, knowing that families and employees may be leaving the city, even traveling internationally. And so we're going to do a test at home process before everyone comes back from spring break to make sure no COVID is coming back into schools. And if we don't see a surge the 2 weeks after spring break, then we'll probably lift the mask mandate at that point and make it optional. We continue to test all students and employees. That will continue throughout the school year. In consultation with the Detroit Health Department, we will start to roll back some of our COVID safety strategies, like temperature checks at the door, symptoms check at the door, employee online symptoms check. So that is going to happen possibly before spring break, but definitely mask beyond spring break. We are excited, as was mentioned, that we do have direct access to the vaccine now. So any child above the age of 5, any family member, any employee can go. Right now, we're at about 10 sites. We'll be at 20 sites within a week. And then we plan to probably have maybe a half or maybe a third of our, or maybe 3/4 of our schools with access of the vaccine through our nurses or contracted nurses. So we'll continue to promote that opportunity. As we think about next school year, we'll still have some level of COVID testing, probably not 100% of employees and students testing. We'll still have a virtual school, but the virtual school will only be for those students who were in the virtual school and were not chronically absent and didn't fail more than 2 core classes. And we may only be offering grades 4 to 12 on the virtual school next year. Really excited about the community engagement process that we've already undertaken with the facility improvement work. We're looking to invest about $700 million across the district through COVID relief funding, and build a couple of new school buildings as well. So we've had one community meeting. We have 6 more, a couple right before spring break, and most of those will happen in April. It is a true engagement process where the plans are not set in stone. We want to hear from everyone about what they like, what they don't like, what could be better. And then the board looks to vote on that plan by May, June, or July of this year. So please send your child to school. It's certainly safe. It's always been safe because of our protocols, but certainly now more safe because our infection rate is extremely low. And we test. So we know that even the infection rate in schools are low. I don't think we'll ever be in a situation where we have to be online again. But that's also predicated on where this variant moves. Don't know if there's any topics that were raised before I came on, but if I miss something, let me know and I'll address it.
Dr. Vitti, I think what you just ended with was really leads to a question that the community has been asking around virtual schooling. So at the end of January, there was families had to opt in or waive to be tested. So will those families remain in virtual school, or is there a process if they really don't want virtual school to come back in to the face-to-face setting?
Right. So as of this conversation, 98% of students have consented to test. The only ones that have not consented were true objectors, meaning their families did not feel comfortable with testing. And so by the end of this week, all students, about 260 whose families objected to testing, will be in the virtual school. Everyone else in schools, whether they be employees or students, will have consented to testing. There are a couple of kids here or there that unfortunately have not attended school since we came back from online learning in early February, and that's why their consent's not on file, but they're not objectors. So to answer your question, those objecting families' children will be in the virtual school at least for the remainder of this school year. Now, as we go into the fall, they probably will have the option of returning to school because we won't be testing at 100% as of today. And so we may only be testing 20% of students to take a random sample to ensure that there's no undetected outbreak in a school, but we probably will not be testing at 100% in the fall, based on the fact that the federal government and the state government at this point, we're not in a health crisis, a public health crisis because of COVID. Obviously, with things being scaled back around masking, we are moving in an environment where the public health concern crisis is not where it was. So therefore, we would not be testing at 100% come the fall, but there would still be random testing in order to ensure that there's no outbreak among employees and students.
Okay, and then so you talked about the pathway out of masking, and so many schools have dropped their mask policies, and I'm a parent, so as soon as it was announced that the mask policy was going to be lifted, I took my son to basketball, and he was there were 2 kids wearing a mask, and halfway through the game, the other little boy took his mask off, so he was the lone masked kid. So as I think people are unmasking, how does DPS plan on enforcing the mask policy? Because I see it becoming increasingly more difficult as you're not doing it everywhere else.
Yeah, agreed. And this is one of the reasons why I think we can't hold on to the mask policy that much longer unless the infection rate dictates that we should. And right now, the infection rate is not dictating that we should. Why we're doing it is to be cautious because of lower vaccination rates, and we know we could see a spike with spring break. So what we don't want to do is eliminate the mask now, rates increase because of spring break, and then try to put the mask back on. I think that will be challenging. But I think if we can get through spring break and there isn't a surge in numbers, that we would be releasing the mask mandate probably a week or two after spring break. So we're talking mid-April, and then not have a mask requirement. It would be optional for employees and students. And then looking ahead, I don't think we bring the mask back unless we're seeing high rates of infection, maybe not quite a surge, but let's say something above 5%, 7%. Maybe we bring back the mask temporarily to just stop the spread, and especially in an environment where the vaccine rates are lower.
So, and then has anything changed? I think when you were on in the past, you talked about a mandatory vaccine policy. Has there been any adjustment to that mandate, or are you thinking differently about that now? Could you provide a bit of an update on that?
Yeah, we are thinking differently about that. So when the school board passed the employee vaccine mandate, it was after, or was on the heels of President Biden's executive order for employers with 100 or more employees to have a vaccine mandate policy. And so that's one of the main reasons why we passed it. Since then, the Supreme Court has struck down that executive order. But two other things happened. One,
We can still hear you.
Oh, okay.
So if you want to get your camera back on, I feel like this is like hashtag COVID.
Oh, got it. Am I back? Okay.
You're back. We see
Yeah.
you.
I have no idea what happened. So two things have happened since the mandate. One, the variant. With the variant happening and penetrating, the employees that were vaccinated, and just seeing very high rates of exposure, and therefore immunity, has changed the landscape of the mandate. The other thing that happened is legally, it is very clear that employees have a lot of flexibility with the exemptions, religious exemptions and medical exemptions. So we were down to about 1,100 employees who are not vaccinated, and already about 300 to 400 have been approved for exemptions. And so that's really a matter of submitting paperwork and using the right language. And so when you look at the reality that most can get an exemption if they wanted, which meant that there would be employees in the schools that were not vaccinated but exempt, it really doesn't make sense to terminate the other 400 or 500 employees that are not vaccinated, especially when about 300 of those were teachers. So, based on the new landscape of COVID and the impact the variant had, we don't have the same sense of urgency that we had around the vaccine mandate. I still believe it's the right thing to do, meaning get vaccinated. But when it has employment consequences and legal consequences, big picture, it didn't seem like the right practical direction forward, especially when the city of Detroit doesn't have a vaccine mandate, or the state was not going to have one, at least for its government employees. So we are looking at next week's policy committee meeting to make revisions to the employee mandate, where we would still encourage it, but not, if you will, enforce it, and not connect it to disciplinary practices regarding verbal reprimands, written reprimands, suspension without pay, or termination. On the student vaccine, we are still promoting it, obviously, based on what was talked about earlier through our clinics, at schools. We think that that's the best thing to do for families and children, but we are highly unlikely to require the vaccine in the fall of 2022 and as a condition of enrollment. The other, even if we wanted to legally, it's becoming increasingly difficult to mandate anything because federal and state laws are moving away from defining COVID as a health crisis, which then gives us less legal leverage to require things to happen. So you're going to see a lot of things changing, I think, nationally, statewide, in the city around any kind of mandates linked to COVID, because you don't have the same legal authority you had only a couple months ago, as it being COVID being more of a health crisis.
So some of the folks that we've talked to, it's going to be more like a flu shot. It sounds like, that many people don't consider the flu shot a vaccine, but that is what
it is.
What it is.
Yeah.
Hopefully that doesn't scare anybody to go get it, because it's important. But it sounds like that's the direction that this is going as well, right, Dr. Vitti? I don't know what happened.
Yep, that would be accurate. I think that's the right way to describe it.
Okay. All right. Well, we're hearing from some folks in the community, particularly the Spanish-speaking community, as it relates to the waiver for testing, that there was some families that didn't understand that they needed to submit a waiver because some of the communication was in English. So if there's any way that you could check in about that, that was one of the comments that I just got. So if you could check in about that, that would be really helpful. We
did have the waiver was sent out in different languages, but yeah, if you have the parents' information, just email it to me and I'll route it and we'll get a follow-up response.
Great. I will ask for that. All right. Well, Dr. Vitti, it's always a pleasure to have you on. I actually love that you're doing this from your car. I feel like I actually have done a town hall from my car, the Kroger parking lot, in fact, while I was getting gift cards for families during the beginning of the pandemic to help to pay for supplies and things like that. So I feel like this is, as we're, as it feels like we're getting closer to an endemic, I feel like it's very fitting that you joined us from the car. So thank you so much. And I'm going to pass this, the baton here to Jametta so she can close us out. Thank you.
Yes.
Thank you,
Dr. Vitti.
Take care. Thank you, Jametta. Bye.
To your entire team for really tireless work that you're doing. It's well appreciated. It's well appreciated.
Thank you.
Thank you. And to all of our audience, thank you for spending the time with us. We want you to also know, you've heard a couple of our experts, and of course you heard Dr. Vitti, our educational leader for the largest school district in the state. If you have some follow-up questions, you've heard Dr. Vitti invite to us that if there are questions, we can get those to him. We're happy to be a conduit for that kind of information, because we are here to serve you. So we've got some really great things that we'd like to share in terms of information. Of course, sometimes we're going to start from home. I'm really pleased, and I think, Deja, that you might be running the slides for us. Yes, here they are right here. So Detroit Parent Network, we mentioned earlier in the program about children with special needs, or what I would call exceptional children. But we know that there's stigma out there if a child has a disability. Please join the Detroit Parent Network for a workshop on removing the stigma from disabilities. We're pleased to have this conversation. That is going to be next Tuesday, March the 15th, from 6 to 7:30 p.m. We have our experts that have been involved in the world of special needs, and we can't begin to help each other unless we address some of the social, emotional, and the societal stigma that we unfortunately place on our children children, which is why so many of us, whether it's for disabilities or mental health, don't get the support that they need. So please join us. Next slide. Also, you've heard us talk about one of our other great partners, Wayne Health. Wayne Health is bringing testing and vaccines as well as screening to you in a whole variety of locations around the city. We really want you to know that this is something that is accessible. You know, one of the things that we've learned through COVID, it's one thing to have to think about getting in a car, something else to try to think about catching the bus, but isn't it so much better when we know that there's going to be these resources that are very near and right in our community? So United Neighborhood Initiative, UNI, is working to make sure that you have access to these services, and there's going to be a program tomorrow, Friday, at their location. Well, as we talk about Women's History Month, recognizing that women, we birth the world. So we are inherently powerful and critical to the human race and certainly the history of this world. And part of that also is thinking about how women have been involved in the development of our spirituality. And that means across different religions. At the same token, what we're going to see, however, is the American Black Journal has been doing a program throughout several months focused on the Black church in Detroit. Please join them to hear about womanist theology, a theological framework in which women are specifically identified in Scripture, and how they have been a formative part of us understanding and engaging our spirituality. That's going to be a great conversation with Stephen Henderson and these dynamic women as part of the Womanist Theology group. Be sure that you join that. That's going to be March 14th. 7 p.m. Of course, one of the best public broadcasting stations in the nation, that's Detroit Public TV, Detroit. And speaking of the leadership, we're really pleased to be sharing with you that there's going to be a policy talks at the Ford School of the University of Michigan. Many of you know that the state of Michigan, and particularly Black Detroiters, have been a fundamental part of social justice in the legal system to get our rights. And so considering this, we're really pleased to see that Reginald Turner, who we all know is an attorney, but also a leader as a jurist. And he will be presenting and discussing leadership in law and policy on March the 14th, this upcoming Monday at the Ford School. And it doesn't mean you don't have to be an attorney to understand our social justice knows that we must understand the law and understand policy to create the change that we need. And so we invite you to please be a part of and listen in on that discussion next Monday. So those are just some of the awesome experiences and opportunities that are coming up. So we want to challenge you. This is Women's History Month, and it is National Reading Month. So pick up a book, find a story, do a podcast, talk to the women in your family, write down their stories and what your grandmama used to say to you, what your aunties have said. Discover the history of women in your own family. Write about it, then read it to your children, read it to each other. And I'm going to try to walk what I talk. So I'm going to do the same thing. Write down a story of an ancestor in your family, a woman who made a difference for you and your family. So with that, we're going to close out our program today. I'm going to ask all of those that have been with us in this production, because these are productions. So welcome. This, you will all see, this is your COVID313 family in front of you. And as we always do, we want to thank you. Thank you, Michael. Thank you, Beck. You're new to it. We're just delighted to have you. And even though not everyone came on screen, they're still wonderful people. So with that, thank you so much. Be blessed, be strong, be well. Take care.